Coming of Age is coming up next. I'm your host, Josh Newby. Today, we're taking a sobering look at end-of-life issues and how to have those tough discussions with loved ones. Then we'll discuss another inevitability of life, at least in Florida, hurricanes, and how elder adults can be prepared. But first, we'll welcome Baptist Healthcare to talk about breast cancer and the support that is available. Stay tuned. Coming of Age starts right now. As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll feel empowered to regain your freedom while retaining what makes you, you. We've been in the community for nearly 50 years, advocating for elders and supporting those who care for our parents and grandparents. We were there when your father's health began declining, when your mother needed companionship during the day. And guess what? We'll be there down the road when you need those services too. Now, join with us as we talk together about the aging issues that matter to you. A breast cancer diagnosis can be frightening, but a new program offered by Baptist Healthcare offers the education and support that helps calm fears and smooths the way from diagnosis to treatment to recovery. Kelly Ward is here today to tell us about the Baptist Breast Cancer Navigation Program. Kelly, thank you so much for coming on today.
Thank you for having me.
To get started, tell us, what is a breast health navigator? That's a new term for me.
So breast health navigator is here for the patients from the time that they are diagnosed with breast cancer throughout their cancer journey. We offer education and support to the patient and their family members so that they can focus on treatment and healing.
Okay, and what do you specifically do?
So I serve as a consistent care manager to the patient during their course of treatment. I assess the barriers, the physiological or the psychological and social needs of the patient, and provide support and education. I also work in a team with the physicians and other support care members to create an individualized treatment care plan which focuses on the patient achieving their desired outcomes. And I work on achieving these outcomes in an effective and realistic time frame.
Okay.
And I also continually monitor and triage the patient's needs across the healthcare system and work with other healthcare providers in the community to ensure patients have access to the services they need in a timely manner. So our services we provide to the family members as well. So we extend these services to help the patients and their family members understand caregiving skills as well as patient self-care skills, which really helps the patient and family members understand what to expect during their treatment and gives them that one-point contact to call when they have concerns or needs that may arise.
We were talking before we came on, you know, a cancer diagnosis is so scary and so intimidating. And I think a lot of patients and family members are, you know, perhaps rightly so, focused on the medical side of what their treatment would entail. But what you do is also so important to the patient. Why is it so important?
So the navigation is important because it empowers the patient to work as a partner with their healthcare team, and through the education and the information on what medical terms and procedures may mean. It also addresses the unmet needs and increases patient satisfaction by responding to a very frequent request, which is information and support. It also provides professional guidance to the patient through coordination, execution, and evaluation of their care plan. And so overall, it enhances patient outcomes, increases patient satisfaction, and reduces the cost of care.
That's well said. Tell us about the benefits to the care team on the other side of this.
So the healthcare team actually benefits because they know that the navigator is building a relationship with these patients, and they know that these patients' needs are being met, whether it is providing education, resources, or support to the patient. And the healthcare team also understands that better patient outcomes actually occur when the patient is treated as a whole.
Okay. Like I said, this breast health navigator term is new to me, but how long has it been in existence at Baptist?
So navigation has been at Baptist for several years.
Okay.
This specific breast health navigation program was developed in 2018, and so we're really excited about what the future holds for the program and what it's going to offer our patients.
Okay, so let's say someone receives a breast cancer diagnosis. That, like I said, they're scared and intimidated. Walk us through that process. What are the next steps? What can they expect as far as your role in treatment and counseling and recovery?
Okay, so a breast cancer patient is actually referred to the navigator once they receive a positive biopsy result or once they have a referral to an oncologist.
Okay.
After I receive that referral, I'll reach out to the patient, I'll make the formal introductions, I'll be assessing for the needs of the patient and understanding what their goals are for their current treatment and what their treatment plans. And during this time, a patient is actually really struggling to process the diagnosis still. So it's providing that encouragement and emotional support to the patient. I'll be calling the patient at regular intervals throughout their journey. I'll be meeting with them at appointments and treatments, answering questions that they may have about their treatments, about procedures, scans, tests, surgeries, whatever's coming up. All of this is managed by the breast health navigator so that the patient doesn't have to worry about who are they going to call. If I have a question, who am I supposed to call for this question or that question? And it's really, again, providing that one-point contact for the patient, which helps reduce some of the anxiety that come with the complex of diagnosis as cancer.
Yeah, because I imagine you would just be lost, especially if you had had no previous interaction with this world. And I guess your background as a social worker, right? That must help really connect with the patients and their family members.
Absolutely, yes.
Is there a charge for these additional services?
There's no fee to the patient.
Okay.
There's no fees to the insurance provider. It's a courtesy service that Baptist offers our patients.
Wonderful. Tell us about some of the other services that Baptist might offer to cancer patients.
So Cancer Support Services has two support groups that meet regularly. We have an oncology social worker. We have a registered dietitian that works with our oncology patients while they're in treatment to meet their nutritional needs. We have a clinical research nurse who works with the physicians in identifying clinical research trials that may be available for our patients. We also have a new scalp cooling system that is available at both infusion centers and is provided to patients that are eligible and interested. And this scalp cooling process is actually showing promising results in reducing hair loss to patients undergoing certain treatments for certain diagnoses.
Oh, really? That's great. You touched on it briefly, but I just wanted to give you another moment to talk about the caregiver and the family side of this and what value they derive from your role.
So the family members often are struggling with how to help the patient. They want to be involved and they want to be that support system for the patient but don't know how. So we really teach them how to communicate, how to understand what the patient's going to need during their treatment, emotionally and physically, and provide them with the resources and the education that they may need to be able to provide that for the patient.
Awesome. Great information. Thank you, Kelly, so much.
Thank you. I appreciate it.
Next, we'll take a frank discussion about challenges we face as we approach the end of life. Stay with us.
Why do people love ACT's retirement life communities? There are more reasons than just the active lifestyle. Like ACT's Life Care, a plan that protects your nest egg with predictable monthly fees, even if your healthcare needs increase. So you can enjoy a carefree today and a worry-free tomorrow. Plan a visit and see why our satisfaction rating with current residents stands at 98%. ACT's Retirement Life Communities, where loving kindness lives.
What does it look like when a life is truly changed?
I feel a sense of accomplishment because I built a house. This house has brought us financial independence.
It's a great place to raise a family.
Strength, fuerza.
When I look back where we've come from to where we are today, it makes my heart very happy.
Potential.
Potencia.
For me, this house means all of us together.
Sorry.
Security.
Security.
Every family dreams to have their own house. This house changed our lives.
Habitat for Humanity is at work in your community and around the world. Through shelter, we empower.
There's a shelter pet who wants to meet you. Meet one today. Visit theshelterpetproject.org. Adopt.
End-of-life issues affect everyone. First, indirectly, with someone we know or love, and then directly as we ourselves age. It's not fun to talk about, but there is a bit of preparation and some conversations that have to happen, especially if we wish to not unfairly burden our loved ones. Luckily, Emerald Coast Hospice is here to walk us through it. Let's chat with Marilyn Gleaton and Vicki Barlow with Emerald Coast Hospice. Thank you both so much for coming on today.
Oh, thank you for having us. This is a great opportunity to talk about end-of-life care.
Marilyn, let's start with you. Tell us about Emerald Coast Hospice.
Well, Emerald Coast Hospice is a nonprofit hospice. We've been in the area for about 19, 20 years in the Pensacola area. We do spread out across the Panhandle, and we provide, of course, hospice services for our patients, and we also have another business line that is a totally separate business line. It's called Emerald Coast Palliative Care, and so we can offer symptom management to patients who aren't quite ready for hospice as far as meeting the eligibility requirements as far as their progression of their illness, or perhaps they are just not willing to accept hospice care right now, and that is where the palliative care program can come in and manage their symptoms. And Vicki is here with us today. She is one of the nurse practitioners with palliative care, and she has many discussions with patients regarding end-of-life decisions.
You know, so many people say hospice and palliative care is sort of synonymously, right? Like they're sort of the same thing. But like you said, there's a very clear and important distinction between the two. Vicki, what are some of the elements of palliative care that make it different from hospice?
Okay, so palliative care is actually for people who have some serious health issues and lots of symptoms that go along with them. And palliative care is a medical specialty, so we help manage their symptoms as well as do advanced care planning discussions. The biggest difference between hospice and palliative care is palliative care, or hospice is a type of palliative care, but hospice patients have to have a prognosis of 6 months or less, whereas my patients do not have to have that limited prognosis.
Okay. Well, with any sort of with issue relating to hospice or palliative care, there's always that conversation that has to happen, right? It can be very difficult for even the best relationships to have. I'm curious, what advice do you have as far as starting that conversation that no one really wants to have?
Well, in my opinion, it's one of the most important conversations you can have. And if you have aging parents, it's a conversation you need to have. And if you don't feel comfortable having that discussion, then you can reach out to someone to help you have that conversation. There are people like myself, you know, like with palliative care, that's one of the things that I do. You could reach out to like social workers in hospitals and places like that they're comfortable having those discussions. Emerald Coast Hospice will sometimes go out and just have those conversations with people. But it's imperative that those discussions occur.
Definitely. You mentioned that Emerald Coast Hospice sometimes will facilitate that conversation, and I think that's one of the many great things that sort of sets you guys apart. Tell us how you facilitate that conversation, how you come in to a very intimate and important time in these people's lives and offer support and offer advice.
Well, many times we have patients who are referred to us that really just want to hear about what hospice is, or I'm not sure if I'm ready for this, or they may call us and ask, I'm not sure if I need hospice, but can you tell me what this is? So we will set up what we call an informational visit, and one of our nurses will go out. It's usually a nurse who's trained with doing informational visits and admissions. They will go out and actually just talk to the patients about what our services are and ask them what their goals are. And what are your goals? What do you want? And we put that with what we can offer, and many times they will decide to go with hospice, or we may decide that, wow, okay, their goals are not quite what hospice care is, they are more appropriate for palliative care, and then we would call palliative care and get Vicki involved.
Gotcha. And that, to me, that tailoring is so important, because not every life is the same, not every end of life is going to be the same. Right. So tell us about really tailoring the experience to meet the client's needs, because it really is all about the client. That's why we're here.
Right. Well, that's where the goals of care come in. Would you say, Vicki?
Yeah. So the way I do it is I walk in and I tell people there aren't any right or wrong answers to these questions. This is information that you want to convey to us. You tell us exactly what you want. So many people end up having futile treatments because nobody asks them and nobody explains to them. And so the way I approach it is we talk about levels of medical interventions. There's full, where you want everything including resuscitation; limited, where you want medical treatment but not resuscitation; and then finally there's comfort measures only. And I help them to understand the differences, and then they can tell us what they want. And as you're sitting explaining these differences to them, people, it's like a light goes on and they're thinking, well, no, I don't want that treatment, but I do want this treatment. Or I don't want any treatment, I just want to be comfortable. You know, I'm tired of going to the hospital. I'm tired of having all these futile treatments done because I know I'm going to be back in the hospital in another month.
Right.
You know, and so it's just giving people the opportunity, giving them all the information they need to make an informed decision. And to me, that's what advanced care planning is.
And as if the end-of-life conversation wasn't sort of, difficult or intimidating enough, there's a lot of documentation, right, that goes into end-of-life planning and end-of-life discussion. Just briefly mention some of the documentation people should be prepared for.
Okay, so the most commonly used thing is the living will. There's a lot of good examples out there, like 5 Wishes is a really good one. It's very simple to use. That's an excellent one. That's for when you become unable to make decisions, but there's a form that I like to use for people that have, say, a prognosis, they're seriously ill, but maybe a prognosis of 18 months or less, called POLST, Physician's Order for Life-Sustaining Treatment. And it's the one that actually breaks things down into the 3 levels that we just talked about and helps people identify, while they're still able to make decisions, what it is that they want. And even if those conversations, even if that paper is not filled out, having those conversations between a parent and a child is important, so that that child doesn't end up doing stuff that their mom or dad might not have wanted.
Definitely, definitely. It's extremely important information. Tough to talk about, but necessary, and I appreciate you both coming on and shedding some light on it.
Absolutely.
Thank you so much.
You're welcome. Thank you.
Don't go anywhere. We will preview the hurricane season with some tangible takeaways to help prepare you next.
Since 1989, TLC Caregivers has been providing the special help people need to stay independent in their own homes. TLC is an employer of choice in the home care market. Our employees are screened with level 2 background screens, drug-free, and have caregiving experience. If you have time, enjoy people, and are interested in joining us, go to tlccaregivers.com to learn more about becoming a TLC caregiver, or visit us in Cordova Square.
Hart, what's going on? I'm leaving. Why? What did I do? Not enough. You constantly ignore me. You barely eat anything healthy. You're half as active as you used to be. The pressure is just too much. I quit. Okay, I get it. I'll do better. Just, please, don't leave. Okay, but remember, if I go, you go.
Listen to your heart. Don't let it quit on you. Uncontrolled high blood pressure could lead to stroke, heart attack, or death. Get yours to a healthy range before it's too late.
When cancer tries to take you away from the things that matter most, Baptist Cancer Institute offers caring physicians and the most innovative treatment options. With convenient locations and a wide array of support programs and services, we're here to help you during the most difficult of times. As a member of the Mayo Clinic Care Network, we're bringing even more innovative cancer care to our community right here at home. When you need cancer care, we'll be there.
For 6 months every year, those along the Gulf Coast hold their collective breath as we watch for new disturbances in the Atlantic. But you can temper some of that worry by being prepared. For elders, that can be easier said than done, but locally, a local agency stands ready to help. Leanne, thank you so much for coming on today.
Thank you for having me.
To get started, tell us what BRACE is.
Well, BRACE is a nonprofit organization that engages with individuals and organization to educate, train, and volunteer service for any emergency needs so that we could keep our community safe, stronger for for any emergency that comes in our way. So
wonderful. The hurricane season just started, June 1st. It's not something that anybody looks forward to, but it's important to be prepared. So what is the outlook for the 2019 season?
So for our outlook, we have NOAA. NOAA is a National Oceanic Atmospheric Administration that has a prevention center that they said is 40% near normal, which that is our outlook for about 9 to 15 storms that will be coming our way, which is about 35 miles per hour winds. And then we're looking at 4 to 8 hurricanes, that is 74 miles per hour winds. And then we're looking at about 2 to 4 major hurricanes like level 3, 4, 5 with 111 miles per hour winds.
So not great, but not terrible either. Just average.
Yes.
Council on Aging, a lot of our clients are elder adults, and for some of them, they're not really able to harden their homes or prepare themselves for a hurricane in ways that others may be able to. So I'm curious, what steps does Brace recommend that elder adults take to be prepared?
So in the emergency management world, we have 4 tips for everyone, especially for our elderly. So for instance, you first need to get a kit. That's for one. With that kit, you need to put all your emergency supplies in. For example, water for cleaning your hands, your feet, so for bathing and drinking, and then that will be per gallon per day. Then you have food, non-perishable goods, so you need a can opener, and then a whistle for help, and then for all different things that you would use on a daily basis that you need for emergency, that would be important too. And then as well as having a lighter kit, so you will have 2 kits, one that if you're going to stay home and one that you're going to go out for any evacuation that needs to be. Second is our plan. You have to make a plan. You have to get connected with people in your network, so your family, your friends, your neighbors, and go over that plan with them as well. So you make sure that this is exercise, and if something were to happen, that they know what's happening to you. And then from there, you could figure out if you want to stay put or if you want to evacuate. With that, it's best to communicate with your local emergency management officials, and as well as to contact them as well to register that you are in the system, about if you're disabled in that regard too, but don't choose that as the only source or substitute for being prepared. So that's another way of going in that way, and also protecting your emergency documents in a waterproof container, and making sure that is one of the things that you need to do. Another thing as well, 3, is to get informed. So as we are here today, you could contact Brace as well. As well as you could contact the Department of Elderly Affairs. You could also contact United Way, get connected of any supplies or any organizations that could direct you to the right source. And citizen information, there's a plethora of things, so like ready.gov and FEMA.gov for any more disaster or hurricane information in that way. And 4, to get involved any way that you can if you're able to get involved in that regard. So
I wanted to ask you about elder adults, especially disabled elder adults who might not be able to take the precautions we think of around the home, like putting boards up or something like that. I mean, what advice do you have for those individuals?
So we have a collaborative partner, which is Rebuild, Northwest Florida, and they provide help assistance in like residential mitigation for hurricanes. And what they could do is that 75% from the FEMA grant that they get, that they could cover helping you to harden your home, and the 25% is what you would have to help out and pitch out for.
So they basically cover 3/4 of the cost.
So it's just contacting them. I think as the season is up right now, they're getting a lot of phone calls and a lot of quotes right now from different applicants, so it's important to reach out to that particular partner.
Let's talk about some other services that Brace offers. I know you all do a lot in the community. What are some other things?
So we're a gap filler. So if any thing that someone would need, any vulnerable person that's been affected, that we try to figure out who could satisfy that need or how we could satisfy that need.
Okay.
So we have a housing facility called Heritage Oaks that majority of our veteran families and low-income families are housed there as well.
Okay.
Then we have CERT. CERT is our basic disaster skills, fire and rescue, our basic medical operations. So we go out and try to tell different workplaces and schools and anything that you could think of like how to be prepared or how you can help our first responders before they get on the scene.
Okay.
As well as we have our own faith-based coalition, which that is an interfaith organization that how churches and other organizations within that hold could help within a disaster or help in any type of way if someone's in need.
Okay. Definitely. So if an elder adult sees a hurricane coming and is in need, they would just call you guys up?
They could call us.
Okay.
And there's different resources we can
sure.
provide them as much as we can.
Definitely. Well, you guys are a great resource. Thank you so much for coming. Hopefully we won't need you, but if we do, we'll know. Thank you so much.
You're welcome.
And thank you for watching. Until next time, enjoy life. You've earned it.
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day I found out I have something called autism. My family got me help. Slowly, I found my voice and learned all the ways I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.